Thank you for inviting me along. It's good to be here. I've not got the...
I don't know, the zapper's still working or is it done?
No, it is working.
Oh, it is working.
No, that's my finger working.
Oh,
Just to introduce myself.
Sorry.
When you can get your act together. Just introducing myself. My name's Ian Short. I am a pharmacist. I qualified in 1980, so I'm even older than some of these guys. The main thing I do these days, though, I have done my time behind the bench, but basically I represent all the 67 community pharmacies in Tameside and the ones in Oldham and very much there as well. So I'm speaking on behalf of all the pharmacies, not just any one in particular. Okay. The statement on there, long and wordy, you've got it in your pack, so I'm not going to read it out, but basically what it says is your pharmacist wants to be your friend in the NHS. We're easily accessible. You can walk in and ask to speak to a pharmacist pretty much any time without an appointment. We're open long hours, and we do see lots of people, quite a few of whom aren't ill and aren't actually on the books of the GPs, which is one of the things we can add to the primary care picture. Thank you. We see ourselves, to a certain degree, that's a slightly pretentious slide, I don't really like it, I didn't design it, but as a sort of third pillar of the NHS. You've got your hospitals, you've got your GPs, and pharmacy can do other stuff as well. The things that we know we are in a good position to do are the ones on the left-hand side there, which are basically making sure that you guys know how to make the best of the medicines that you've been prescribed. And we all know that medicine is the second most expensive thing in the NHS after the staff costs. We want to help you do all the things that you've heard about, like look after yourself when you're poorly, both when you're not really poorly enough to want to bother the doctor, and also when you are managing a long-term condition. We can help give support, because to be quite honest, people with long-term conditions need all the help they can get from whoever is in a good position to help them. So there's a good role for us there. We want to keep you out of hospital in the first place by improving public health. So we are getting much more involved these days in things like public health campaigns. So you will see posters in pharmacies every so often reminding you about 5 a day, or take more exercise, or stop smoking, or whatever it might be at the time. And perhaps even more importantly, we want to help people to stay independent, stay living in their own homes. So we'll do things like help you to manage your repeat medicines through the NHS Repeat Dispensing Service. We can help you to actually get your medicines at all by delivering them to you. And we can also provide support and aid for physical inabilities as well. So, some pharmacies will be able to order things like gadgets to help you open medicine bottles and stuff like that. But it's not all medicine related. We do a lot more than medicines these days. Okay. So, some challenges for us though. Most patients I've spoken to over the years seem to assume that we know everything that the GPs know, and that they know everything that we know. And they're sort of saying, well, why are you asking me that? Because I only told that to the doctor last week. Or I get a message from the doctor saying, what was it you sold that person the other day? Because they seem to have done really well on it, and I'd quite like to add it to their prescription, or whatever it might be. The challenge is that actually we're not joined up in an IT sense. Apart from the electronic prescription service, the systems that pharmacy use are specific to the pharmacy itself. So we don't actually routinely share that information. We can, we are going to get access to the summary care record, which isn't quite as comprehensive as the fantastic online service that Dr. Hannon offers, but it's a step in the right direction. But we would need to have your consent to access that every time we need to look at it. What you need to understand perhaps is why we might want that. And one of the reasons for that is we need to understand what's wrong with you so we can advise you best about how to manage whatever problem it is you've come in to ask us about. You can be confident that the pharmacist has got the skill. We've all been to university, we've all got degrees, and we've been studying for 5 years to get to the point. We've all had to do on-the-job training. The staff all have training requirements as well. Resources is a little bit more difficult, certainly under the NHS. Funding, as we very well know, is almost, well, I won't say non-existent because that's not right, but it is severely challenged. And one of the things that's disappeared is funding for local training. We're picking that up, but we do need to make sure that that people are aware that there is a challenge for us around getting funding for training when we need it. Another problem we have is that you guys, when you come into the pharmacy for your prescription, tend to expect, or you judge the value of the service or the quality of the service by how fast that prescription ends up in your hand. What doesn't get taken into account is all the safety checks that have to be made, any particular special ordering that has to be done, the fact that the person in front of you in the queue has got a prescription this long, so there are all sorts of factors that feed into that, which you may want to pick up in more detail if there are any questions. But generally speaking, just because the pharmacy takes its time, may mean it's doing a more thorough job. So that's one of our challenges anyway. Another one, patients have a right to choose which pharmacy to go to. Nobody can tell you which pharmacy to go to. Unfortunately, there's a bit of misleading information. Some of it appears as a letter, some of it may appear to come from the NHS or even from your doctor. It hasn't. It's probably come from a pharmacist touting for business. If anything or anybody tells you you must go to this pharmacy for this particular, for your routine prescriptions, they're fibbing. It's your choice. You can go where you like, where you feel comfortable. And I would always recommend you choose a pharmacy which gives you a good service, you're comfortable with, you know the pharmacist, they know you, they can build up a picture of you, and they can really give you the best service that way. There are one or two slight exceptions. Some services aren't always available in every pharmacy, so there may be a justification for directing somebody there for that particular service. But when you go there, if they say to you, well, now you're here, we'll do your repeat prescriptions for you, always remember it's your choice. Okay? Okay, those are some of the challenges. There's lots of encouraging signs at the moment. It's quite an exciting time to be in primary care, apart from all the pressures and stresses. The work that is going on in Healthwatch in particular to raise awareness of the wider primary care is really good. I've done some work, not specifically in Tameside, but I've done a lot of good work with the carers resource in Rochdale, one of the other areas I cover, and the support that pharmacies have been able to give to carers has made a real difference for them. We've been able to identify carers and encourage them to go to the resource and actually register and let people know that they are a carer. It's amazing how many people out there just either don't think of themselves as a carer because they're just looking after somebody in the family, and that's just what they do in their life. But they can get support, and they can get respite, they can get support with benefits, they can get all sorts of special care and attention, because as was mentioned earlier on, the value of you guys out there that care for each other is huge, and we can't neglect that. Access to summary care record I've mentioned. Care closer to home has also been mentioned. That obviously means that if we take some of the services which are currently being delivered in hospitals, that puts a bit of extra pressure on the GPs. And some of the stuff which the GP is doing, as has already been mentioned, perhaps don't really need to be there. Pharmacy can help support. So we can act to sort of prop up the pyramid a bit. It's good that we're getting a bit more cooperation with GPs and hospitals. We're not getting very much in the way of two-way referral into pharmacy services yet. I think probably because the referral pathways haven't yet been designed. There is a bit of a challenge in getting people to remember that they exist, because people tend to focus on doctors and nurses, which is one of the things which annoys me about politicians and journalists in particular. They forget all the other sort of 20-odd different professions that make up healthcare professionals. Another thing which is on the horizon, we've got one or two locally, but that's all the pharmacist independent prescribers. So they would be people who would be able to look after people with specific conditions under specific circumstances that they're trained to do. Okay. So that's there. That's where pharmacy's at the moment. I think it's very encouraging, very exciting, and we want to be part of it. Please don't forget about it.